Gynecologist, what's the most horrific thing you've ever seen? A gynecologist is on the phone. I sometimes encounter unpleasant cases where a woman wears the same tampon for days or weeks. Necrotic vaginal cancer also looks pretty bad, but it doesn't even come close to the most horrific case in my life. Once, a 19-year-old woman came to our clinic and complained that she had a hairspray cap stuck in her vagina. Well, no big deal, I naively thought. But the catch was, she'd stuck it in there at 15. So 4 years ago. She didn't explain her motives, but it was clear she was deeply ashamed. Even before she undressed, you could smell a truly awful odor, which got even worse when I investigated the problem. The cap was inserted upside down, and it was clear that it had become heavily encrusted with vaginal tissue over the past 4 years. The difficulty of treatment was further compounded by the fact that the cap had punctured her bladder and rectum. Several extensive surgeries were required to remove it. I'm not a gynecologist, but I know someone who recently had a hysterectomy. The woman had stitches in her vagina that needed to heal, but she was so eager to resume sexual activity that she gave in and relapsed, causing her small intestine to fall out. I was told everything in such detail that I think I'll never be able to eat ground meat again. The woman herself said that when she was on her way to the emergency surgery, she felt her small intestine resting on her leg and pulsating. I had a friend in high school who was terrified of going to the gynecologist. When she finally decided to go for her first brain exam, she was so nervous that she clamped her legs around the doctor like a vice. She says it took a while before she could relax and let him out. It was incredibly awkward. Now, of course, she laughs about it, but her shyness about her female organs hasn't gone away. She doesn't even like using tampons. I'm a medical student. I once signed up to assist in a hysterectomy. When we went into the surgery, we were told it was a small ovarian cancer, but it turned out to be much worse. The patient's entire viscera were covered in metastases, so we spent 13 hours just reducing their volume, although the entire operation should have taken about 3 hours. At some stages, we were assisted by specialists from general and vascular surgery. We replaced half the patient's blood volume. After everything she had been through, she was in great pain. She had a long and difficult post-operative period. But in the end, she somehow recovered and returned home to her family. It was a very debilitating case for all of us, but both the patient and her family turned out to be wonderful people, so we were honored to help them. My dad told me about a woman who was severely addicted to heroin. For some unknown reason, one day she decided to get creative and injected herself in the labia. What led to gangrene? I don't think it was worth it. A little late in replying, but still, I'm a medical student, and in a few weeks I'll be a full-fledged doctor, though not exactly a gynecologist. When I was interning in gynecology, I was sent to examine a young lady. While I was preparing for the examination, the smell in the room became so bad that I began to think I was about to get the worst case of bacterial vaginosis I'd ever seen. I reached inside, began to examine everything, but didn't see any unusual discharge. Strange. I started to move back and felt that the further I moved, the stronger the smell. It turned out that her feet simply smelled terribly. I worked as a doctor, though not exactly a gynecologist. When I had a gynecological internship, I was sent to examine a young lady. While I was preparing for the examination, the smell in the room became so bad that I began to think I was about to suffer the worst case of bacterial vaginosis I'd ever seen. I reached inside, began to examine everything, but didn't see any unusual discharge. Strange. I began to move back and felt that the further I moved, the stronger the smell. It turned out that her feet simply smelled terribly. I have a story not about a vagina, but about boobs, but it's no less disgusting. When I was in high school, I joined a student organization that sent students on internships. I decided to go help out at the emergency room. One time, a very overweight woman was brought in. She complained of chest pain. Everyone noticed that she smelled really bad, so the doctor decided they needed to wash her and examine her. He washed her, lifted one of her breasts, and such a rummaging started going on that we all nearly passed out. Under the breast, there was a colorless scab. The doctor washed it. The scab peeled off, revealing a small hole from which cockroaches started crawling out. Most likely, she had laid eggs in the fold under her breast, and when they hatched, the cockroaches couldn't find a way out, so they had to chew their way out. My mother had a story that I think is the most disgusting of all the hospital stories I've ever heard. One time, a patient in her 50s, very obese, 227 kilograms, came in and said that her husband had complained of a strange odor during sex. But the funny thing is, it wasn't just her husband who smelled it, but the entire hospital. Anyway, I don't remember all of the details, but it turned out that her entire vagina was necrotic. She needed surgery, but it didn't save her. She died soon after. The best part of this story is that her husband, Ed, smelled this hellish odor first and during sex. I'm not a gynecologist, but I've seen my share of horrors. First, I saw a woman with vaginal cancer. Then, I saw what happened to her after a complete removal of her vagina and cervix. It wasn't much to look at. I can't describe all the procedures exactly because I was a very young student at the time. But in the end, all that was left of her former organs was a large hollow hole with something dripping out. The poor woman was so heartbroken that she begged her husband to leave her because, and I quote, "You'll never be able to love me after this." But he turned out to be a great guy. He was by her bedside the whole time, holding her hand, comforting her, and nourishing her with love. It was obvious he absolutely adored her. A 220-kilogram woman with lower limb paralysis was admitted to us. She had a giant ulcer and necrotizing fasciitis, which had destroyed everything in the genital and buttock areas. There were erosions in her rectum. We realized this because feces were leaking from several areas of the damaged surface. When the doctors asked us to collect a urine sample, it turned out that she no longer had a bladder, nor did she have a vagina. It was decided to try. 6 of us somehow rolled her onto her side and essentially started stuffing a bunch of gauze into the giant hole. I hope she doesn't shit herself during the procedure. She died very quickly. In such cases, we are powerless. I'm not a gynecologist, but I've had a birth defect that I ignored until I started using tampons. The thing is, I developed a septum, which left me with 2 holes instead of 1. I only realized I had a problem when I tried unsuccessfully to remove a tampon. I'd inserted it through one hole, then tried to get it out through the other, smaller one. That's where it got stuck. It was excruciatingly painful, but there was nothing I could do about it. Luckily, it happened while my mom was nearby. She thought I was just an idiot who couldn't get a tampon out at, but then she saw what was wrong and took me to the gynecologist. They had me operate, and now I have no problems. I'm not a gynecologist, but while I was working in the emergency room, I also saw one interesting case. An elderly woman was brought in after a fall. We started examining her, and she had a gigantic cancer in her vagina. Her pelvis looked like 2/3 of a soccer ball had been glued to it. The tumor was so large that it was pressing on the nerves in her left leg and cutting off blood flow. That's what actually caused her to fall. Do you know what happened to her afterward? No, they were still working on her when I left. I hope they eventually placed her in hospice care. It's just that with a tumor like that, there's no point in doing chemotherapy, radiation, or surgery for 80 years. I work as a nurse in a gynecology department. Oddly enough, I rarely encounter anything truly horrific. Women here are quite meticulous about their vaginas, and the vagina is a very resilient organ. It can withstand even the most inappropriate treatment. The most horrific case was when a woman came to us for a hysterectomy. At the beginning of the operation, the surgeon made a mistake and accidentally cut her intestine. It was decided to interrupt the operation until the intestine healed, but everything went wrong and it didn't heal. Eventually, the intestinal cut soon healed over the postoperative wound, and a fistula formed through which feces came out. And wounds through which feces come out are not so easy to heal, you know. As a result, the woman spent 9 months in the hospital, enduring a myriad of infections, wound ruptures, complex dressing changes that lasted for hours, and so on. At one point, her fecal wound was so large that 2 of my fists could easily fit inside. It all ended with her receiving a permanent colostomy, a poo bag, and according to the latest reports, her uterus was never removed.
Thank you so much for watching. Gynecologists are welcome to share their stories in the comments. And don't forget to check out our other videos and subscribe. Bye!